Hi, I'm Beta Hill, and this is the D-Word podcast, where we talk dementia. Welcome along to another D-Word podcast. Our topic this time is brain health, as I'm joined by Doctor Janice Ranson from the University of Exeter, who is part of a European project aimed at providing a roadmap for brain health services. So how did that project start?
Well, I think for me, what's really made a difference is the increase in the amount of really rich data that we've got available to think about our brain health, not just in later life, but throughout the life course. So, I've been researching dementia now for almost 10 years, but this body of evidence has been going on now for maybe over 20 years or more, thinking about what the risk factors are for dementia. And I think a lot of epidemiological evidence is now, we've got to the point where we've got a good idea of the different risk factors that contribute to our dementia risk. But thinking about how those things work in combination for a given individual and at what point in their life it makes sense to actually intervene, that's kind of where we are. And the exciting bit is what the opportunity is to use all this data available from things like electronic health records, from population-based studies, from clinical trials and so on, to actually kind of tease apart that complexity. Your dementia risk really starts before you're born with your genetics, as you know. We've all got a given risk of dementia, but the kind of positive side of that is that it's not completely determined by our genetics. And so that's different for different forms of dementia. But for most types of dementia, there's different things going on in our life, all the way from our early life, from our education, through the midlife, where we're making decisions about our lifestyle, all the way through to late life. And all the way through that lifespan, there's different things that we can be doing, both as an individual and as a society, to modify that risk. So that's kind of the idea of brain health services, is to not just to wait until we've developed the symptoms of dementia and then try to treat it or try to make a difference at that point. There are some things that you can do, but really, if you can go earlier, as we know, the actual underlying diseases that cause dementia start decades before the onset of the symptoms. So that's kind of the motivation for this, is to think a little bit more cleverly about what we can do to help people to prevent dementia.
Yeah, I think, the whole thing of brain health, to me, we're fairly aware of cardiac health and all those factors that can build up for that. We've even had TV adverts with cardiac health, but I still feel that, the message needs to get out there to the public about brain health.
Yeah, and particularly for people that are a little bit younger, I think people aren't really talking about their brain health. You don't hear that. People talk about, like you say, that they talk about things like cancer, they talk about things like the cardiac risk. They're not really thinking about their brain health. And a kind of an analogy that works for me, that makes sense to me, is this idea that if you were saving money for your future, for your old age, you don't start saving later in life. You start saving as early as possible. Yeah. So if you're thinking about your brain health, the decisions that you're making earlier in life, both, like I say, this is not just on an individual level, this is on a societal level as well. And it's thinking about how we can help, because when scientists talk about modifiable risk factors, that's not necessarily always modifiable on the individual's level. So things like what you eat, things like what exercise you can do, things like that, you've got some level of individual control over that. But things like your education, that's not necessarily something that you as an individual have that much control over. And it depends on where you live. It depends on what's available to you. And there's a lot of inequality in the opportunities available to different people within and across countries. So I think that's something to bear in mind as well, that this isn't something that is necessarily equal to everyone, and we really need to think carefully about that when we're thinking about putting interventions and services in place, that we're not just making that available to the people that can afford it or to the people who have got the support in the background to make those sorts of changes. So I think that's something for me that's really important, and that speaks to the interventions themselves, but also to the underlying data that we're using. And when we're thinking about identifying what people's risk is, the data available to us isn't necessarily capturing everyone that we need it to. So I think that's something to bear in mind as well. But yeah, I mean, going back to the idea of what people are talking about and that awareness, I think, we all know that as you age and you get older, people start thinking about their memory more. It's one of the most feared conditions in the over 60s, but people in their 50s and 60s have got a real opportunity to modify that risk in a way that kind of declines as you move through the decades. So it's really important, I think, to capture the attention of the population at a much earlier stage. And that's going to take all of us to come together, isn't it? And for governments to really get on board with this idea that it's not a kind of all doom and gloom, and some people develop dementia and there's nothing you can do. We've got very good evidence that there are things that we can be doing to help people to prevent their dementia risk.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
You're in June with the D-Word podcast, and I'm chatting to Doctor Janice Ranson from Exeter University about brain health. One of the things that happens after people have a diagnosis is suddenly they feel that it's the end of everything, which is definitely not the case.
Yeah, so, I mean, the current system we've got is in the form of memory clinics, and I guess for people that aren't super familiar with that, the idea is that you would either be referred from maybe your GP, or if you've got access to private healthcare, you can self-refer to a memory clinic. And this is normally for people that have got some kind of what's referred to as a subjective cognitive complaint. So these are people that have themselves identified some sort of concern with memory or cognition or related problems. And the waiting list is one of the biggest problems here. So there's huge variation, but across the UK, you could be waiting months, maybe even over a year for your initial appointment. So you can imagine that kind of the impact of that in itself, the apprehension of waiting for your appointment. You then go through a fairly long assessment, potentially, of taking your history, neuropsychological tests, cognitive tests, imaging, and so on. And if you're identified as someone who has dementia at that point, then you're fed down the route of the diagnostic services. But if you come out of there at that point and the clinician says, well, we don't think that you've got dementia at the moment, this is really the point at which the suggestion of brain health services comes in, because rather than just giving someone generic healthcare advice, reassuring that they don't currently have dementia and then sending them away, what that person really wants is something a little bit more nuanced and a little bit more personalised to them and their situation. I think a lot of people in that position want to know what their dementia risk is, and obviously we shouldn't be pushing this information on people. It will be led by what people want, but I think if we've got the evidence now to be able to profile our risk of dementia and to put in place programs to help people manage that dementia risk, then to me it seems obvious that that's what we should be doing, rather than waiting for that to get worse and for them to develop symptoms before we actually do anything for them.
Yeah, it kind of seems to me that I suppose call them the worried well, are the people that kind of fall between the cracks at the moment.
Yeah, and I mean, it depends on how you look at it as to whether they are well, I mean, there's a bit of a distinction, I think, in when we talk about dementia, whether you're talking about the underlying diseases causing dementia. You can have the neuropathology much, much earlier than the symptoms of dementia. So I guess it depends on what you're talking about as, in terms of brain health. You might be functioning well. It might not be interfering with your activities of daily living, but you might have the pathology of dementia, and you might have the risk factors that suggest that within a given period of time, be it 2 years or 5 years or 10 years, that your risk is higher than it would be for the general population. And that's the group where there's an opportunity to really help. So the idea of being able to identify those people who are at higher risk of dementia than most people, and to help them to reduce that risk, rather than, like you say, waiting until they've developed symptoms and then try to treat it. I mean, you might not be able to prevent that person developing dementia at all, but if you can delay the onset of the symptoms, even by a year, obviously this is a cumulative thing. So it makes a huge, huge difference on a population-based level to be pushing that as far as possible. So I think the idea of delaying and preventing dementia can kind of be quite similar in some cases. I think what most people want isn't necessarily to live for a really long time, but to live healthily for a really long time. So it's that idea of healthy longevity, and the quality of life is what you're trying to preserve.
Yeah, I guess money makes the world go round, and in delaying the onset, there must be a financial incentive there as well.
Yeah, I mean, there's been a lot of economic modelling and forecasting around that. That's not my particular area, but I think it is really, really interesting that you can put a kind of financial estimate on that. I mean, obviously, the burden of dementia is very expensive, both for formal care and informal care. So it's not just the money, is it? When you talk about the cost of dementia, it's the societal cost as well as the economic cost. But I mean, yeah, it makes sense for governments to focus on this. And I suppose what will make the difference isn't just the academics coming together as we have been and developing suggestions and plans and recommendations, but someone's got to fund that. Someone's got to kind of value it enough to say, okay, we're going to put some money behind this and develop these sorts of services. So I think where we are at the moment is we've collected the evidence as best we can. We've put together a package of recommendations. That's not necessarily what each individual brain health service will do. It will depend on who's running it. It will depend on who's funding it. And it will depend on how that evidence progresses. So at the moment, our risk profiling tools, for example, they're fairly accurate, but they are actually based on fairly simple kind of additive models. As we go forward, we can use kind of maybe more fancy mathematics, things like machine learning and artificial intelligence to kind of tease apart that complexity of individuals' combination of risk factors to a much, much more accurate degree. So I don't think that the details of what the brain health services look like is necessarily the key issue here. The key issue is identifying that opportunity for this to make a difference. And as you say, try to convince governments to value the health of the population in terms of their brain health.
Yeah, I guess it all comes down to communication in the end, as we were saying at the beginning of the conversation, to get the public on board with this whole message about brain health. Yes,
I think that's probably going to be one of the trickier things. But I think we've done a fairly good job of that with other health issues, things like smoking, things like cancer. Those kind of public health campaigns have been really successful. And I think people are genuinely interested in this. It's just that they're not necessarily thinking about it. So when you talk to someone about, have you considered your brain health? Most people in midlife would probably just look at you a bit strangely and wonder what you're talking about. But once you start talking about what that really means, it's not a difficult concept to get across, actually. The idea that the lifestyle choices that you're making, the environment. I know that you've spoken before to academics about things like air pollution and dementia. That's really important. You know, managing your vascular system, things like that. I think once you start giving people examples of what this would mean, they kind of start nodding along and they're going, okay, yeah, you know, I can get on board with that. But no one's really made a big issue of it before, so it's not something that's occurred to them.
Yeah, and
they just think of dementia as something that happens in old age. You know, it happens to older people, and that's when you start thinking about it. And I think that's that kind of saving for the future concept that's what we really need to get across.
Yeah, it's interesting. You know, my kind of previous life in employment, I did a lot of work with younger people talking about pensions. And it seems to me there's a great similarity between where we are now with brain health and that kind of tool. When you're 25, you think, well, you know, what's this got to do with me?
Yeah, absolutely.
But I guess the media's got to play a role here in getting that message out there.
Yeah, I think it's going to require the academics to come together with media and to maybe come up with some clever ways of getting that analogy to make sense. You know, I completely agree with you, that idea that 25-year-olds are probably not that interested in saving for their pension. They'd rather spend it now. You know, if you called that, you know, brain health credits and you're putting them in your piggy bank, then it's the same sort of thing. And I don't think we've got the kind of the evidence quite yet to say exactly, well, if you eat one extra portion of vegetables today, your dementia risk is going to be reduced by X%. You know, that's a bit artificially specific. So I think it needs to be kind of broad strokes. But in the same way that the NHS, I think, is making really great strides in talking to people about their BMI and providing them with visual tools of, you know, well, if you reduce or increase your BMI, depending on which end of the scale you're at, to come into a more of a healthy range, then these are the things that it would help in terms of your health. And they're not giving you particular numbers of, you know, this is the percentage that a particular medical condition is going to be reduced by, but they're giving you kind of broad strokes indications of where you should be sitting on this sliding scale of health. And I think there's an opportunity to do something like that with brain health. But it would require the kind of the big guns to come behind us and get on board with that.
Yeah, I think it's forever thus with, you know, lots of people I talk to with, you know, some great research and great ideas. He's getting those people in government to actually kind of sit up and take notice. And as you say, kind of coming up with interesting and new ways of getting a message across, which,
yeah.
You know, I think one of the things interesting, you know, I've read the report, and there was a bit in there about use of plain language. So, you know, he's talking about well-structured, logically sequenced information and reduce and eliminate statistical and clinical jargon. Now, I've got a friend, Wendy Mitchell, who's living with dementia, and Wendy has a jargon jar. Every time she goes to see a specialist and they realm into jargon, she actually rattles the jar and expects a contribution. And I think there's a lot to be said for that, about using plain language and the right communication.
Yeah, and I think that the real key to that will be academics working with people with lived experience of dementia, either themselves or within their families, to kind of help them to co-develop these sorts of resources and interventions, because academics talking to each other and then deciding that they're all making sense isn't really the point. It's whether it makes sense to people who aren't living and breathing that sort of language every day. And as you say, you need to get rid of all that jargon. And sometimes it's quite difficult for academics to kind of get rid of that because it becomes a bit of a habit. But actually, these concepts that we're talking about they're not complex. They do make sense and they do matter to people. So I do feel quite hopeful that we can get there. And one of the reasons why the idea at the moment is to develop the brain health services as part of the memory clinics that are already up and running, is that we've already got the health service on board with that. This isn't a case of just developing a completely new service that's unrelated to what's already going on. You can kind of develop it as a bit of an add-on, a next step to what we've currently got going. And then once that's up and running, then you can think about broadening the range of people that could apply to. So you can start to think about other groups that would benefit from these sorts of interventions that maybe aren't necessarily presenting themselves in that way. I think it's very similar to a lot of areas of public health where the people that need the help are often the hardest to reach. And I think this is probably going to be the same sort of situation, but you have to start somewhere. So I think it does make sense to kind of develop this initially as a bit of an add-on to the current memory services that are already up and running. But yeah, the idea of resources is definitely going to need addressing. But if you can identify people at higher risk, then that can help with things like the memory clinic waiting times as well.
Yeah, I think, it's one of these things that when you look from the outside, I used to have this concept at work that if a Martian landed on the green outside our office and you explained the concept to him, and if he nodded, it was a good one. If he shook his head, he said, what the heck are you doing? And this seems to be so obvious to me. I come from a public health background, very frustrated. I never heard anybody mention dementia when I was working in public health. And this just seems so obvious to me. And it's kind of one of those things, it doesn't take an academic or whatever. If you presented a number of my friends living with dementia with this concept, they'd all go, cool, that's really great.
Yeah. And I think it's interesting, that idea that dementia has historically been ignored in public health. I suppose a lot of that has been that attitude of, oh, well, there's nothing we can do about it anyway. What's the point? That kind of very fatalistic kind of point of view. And I think that is gradually changing. We're not completely there. I mean, in terms of the academic evidence and our productivity and our knowledge, we're probably around 45 years behind things like cancer. So we've got to do things kind of differently. We can't just wait 45 years to catch up. Dementia has always been incredibly underfunded compared to other conditions. And, as you know, with new treatments now becoming available and better evidence for how we can prevent dementia, I think these are the opportunities to really capture the hearts and minds of people and say, hey, this is something that we can do something about. There's some hope here. And all we've got to do is to pay attention and take notice of it.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
You're in tune with the D-Word podcast, and I'm chatting to Doctor Janice Ranson from Exeter University. I guess it's all about balance, isn't it, between prevention and cure, and how much resources are put on either side of the coin, and also it's a case of just getting the correct message out through the media. I mean, I had an example when I was working with people living with dementia, someone who brought me a newspaper headline that said, eat more strawberries and get your dementia risk. And he was, well, I'll have to phone my wife now and tell her to buy some more strawberries. Whereas, you got to try and control, it's very difficult to try and control the media to get those right messages across.
Yeah, well, I think if you read the papers every week, there would be a different cure for dementia every week, wouldn't there? I remember my grandmother once rang me up in a bit of a panic. And she said, Janice, have you seen the news? She said, they've cured dementia. You're going to have to find a different job, maybe cancer. She was completely convinced that they'd put me out of business. And I think the media it's got its faults, but it's also really helpful in a lot of ways. And as a way of communicating these kinds of ideas with the general population, I think if we can get them on side and give give the media some good news stories. You know, we don't always want negative things in the news about things that are going to increase your dementia risk. If there's a package that you can put together for people that will actually be a good thing, you know, to me, that should be newsworthy. But I think one of the tricky things, I think it's interesting what you said about the kind of prevention and cure being on different sides of the coin and that balancing the resources. I think there is some truth in that. But in a way, some of these things kind of make sense to do anyway. So kind of regardless of your dementia risk, you know, you're never going to have someone say to their friend, "Oh, I think you've got a problem with hearing impairment, so you should really get that looked at because you might develop dementia." It's like, well, no, you should get that looked at because you've got hearing impairment. You know, so some of these things, it makes sense to be healthy and to take care of yourself and your health and your environment anyway. So I don't think that necessarily needs to be balanced against helping people who've currently got dementia and need that treatment. That's always going to be the case. And we're never going to develop a perfect model that's kind of 100% accurate where we can completely control everything and prevent all dementia cases. You know, that's never going to happen, partly because genetics and our environment does combine with this. And some people are just going to be incredibly unlucky. So there's always going to be a need for that on the other side. And thankfully, that's starting to look more hopeful than it ever has before with the new treatments that are becoming available. But that idea of healthy longevity, I think, is what we need to be selling. And that's not just our dementia risk, obviously. It's a lot of age-related conditions. But dementia is the most feared condition. And I think that's, if we can get a grasp on that, and that also makes us healthier in the process, then that's not a bad thing.
Yeah, absolutely. I'm reading a report. One of the interesting bits for me were you've got these 4 pillars for development of brain health services. And one of them, cognitive enhancement, which is of real interest to me because it's saying things that, you know, don't feel enough is being done to encourage people doing paper-based exercises, reminiscence, and all this whole sphere of things, which, you know, it is being shown are very useful.
Yeah, I mean, that's not my particular area of expertise, but I do know that there's a huge body of evidence around that, and the evidence has been it's been slightly mixed. So there's been a lot of organisations setting up things like brain training interventions and things like that. Some of them are evidence-based and seem to make a difference. Some of them not so much. So I think you need to be careful. I think, you know, as soon as you go onto the App Store on your phone, you'll see a whole raft of different organizations trying to sell you all these different things. And I think the difficulty there will be teasing apart the ones that are evidence-based and helpful from the ones that are just packaged to look really exciting. And are there to kind of help companies make money. So I'm a little bit wary of what's already out there. I think the things that some of the academics are developing could have real potential and could be really helpful, but there's also a lot of stuff out there that is not so great as well. So that's just something to be a little bit mindful of. But the idea that people can actually have some sort of control over developing these strengths and developing their cognitive health it's actually, I think it's quite empowering and it's a really positive message. And I think that will be part of what will help in getting across that idea that there is something that we can do here and that it depends on how you want to spend your time. And if you're willing to spend some time engaging in more cognitive activities, then that's going to help you overall, particularly if they're more social activities as well, rather than just being on your own.
Yeah, definitely. I think, loneliness is a big contributory factor. And also, we talk a lot to carers as well. And, for them, it's kind of, whenever I look at it, I call it a team approach. So if you've got a carer and a person living with dementia, and if they actually contribute both then suddenly things are not quite as gloomy. And I think carers play a massive part in all of this as well.
Yeah, and that's going to be a huge part of what makes these sorts of programs a success. So whether it's cognitive enhancement or whether it's risk reduction, these kinds of interventions that are going to be developed going forward are really going to need to take that into account, because often it's going to be the carer that is going to be that motivational factor in putting some of this into practice in a way that makes sense for the individual. And different interventions won't necessarily always be effective to the same extent for every person. So this is going to be, it's going to need to be a really personalised kind of thing. So looking at people's particular combination of risk factors, as well as their current lifestyle and the things that they need. You know, some people would really benefit from reducing their social isolation. Other people will need a lot of help in improving their exercise or addressing things like depression. So what kind of intervention makes sense is going to be very dependent on that individual's circumstances. And like you say, it's not just them operating as an individual. You know, we don't walk around in a vacuum on our own. We're social beings and we've got a social structure. And it depends on what that looks like for that individual person's life.
Yeah, it kind of brings across the phrase, you know, when you've met one person with dementia, you've met one person with dementia. It's a very, very personal thing. I mean, the report's been out. It's been published in the Lancet. I mean, what's the reaction been?
Well, I think the reaction from the academic community has been great. I think the reaction from the public is probably that's going to have to be something that we wait and see as to whether these things are set up. Because at the moment, what we've got is a kind of a package. We've called it a user manual. It's a kind of a six-part series. And that's really aimed at organisations which are considering setting up these brain health services in the future. So at the moment, there are some brain health services dotted around, but they're generally not available to most people yet. So I think really the point at which we capture the public will be when these ideas really come to fruition and these brain health services are rolled out and made more available to the population. That's when it's going to make a real difference to people. But at the moment, we're still at the level of putting those plans together and kind of making the case for why these services are so important for our governments and health services to invest in them.
Yeah, I think it's a great bit of work. I think it's a great idea, and you know, I really do hope that people do take it on board. Unfortunately, time's drawing us to a close, Janice. It's been absolutely fascinating chatting to you about the subject, and as we say, please keep on doing what you're doing because you're making a big difference, and you know that is really important.
Oh, thank you, Pete. It was really nice catching up with you.
My thanks to Janice, and I hope in future we'll think much more about brain health. That's it for this edition. Thanks for listening, and I hope you join me again here on the D Word podcast. Take care now.